Hi, welcome to the COVID-19 Lake Norman and North Mecklenburg briefing call. Today is Monday, April 20th. Hope you had all had a nice weekend. My name is John Bradford. I'm your briefing call moderator. I'm a small business owner of two different businesses right here in North Mecklenburg, and I'm also a former member of the North Carolina House of Representatives, and it's my pleasure to be your moderator. The purpose of these calls is to bring together healthcare experts, government officials, and business leaders to provide regular COVID-19 briefings to help update, educate, and support the North Mecklenburg region during the outbreak. We are still under it started as a 15 days to slow the spread, then it got extended to an additional 30. So that's going to happen for the rest of the month. There's two great websites here, cdc.gov, coronavirus.gov. And the point of slowing the spread is basically if you feel sick, stay home. If you're older, please stay home, stay away from others just because you would be a little bit more at risk. President Trump announced social distancing requirements through the end of April. So obviously we need to continue to social distance, and you can see on your screen there's a graphic which shows the big difference just by social distancing. So we hope everyone will continue to practice that. Use of cloth coverings are still being recommended to help slow the spread of COVID-19 from the CDC. If you need any cloth coverings, you can order some from Aneralla Mills. You can go to shop.anerallamills.com. I ordered some from them, and I have a lot of people that I shared this with, and I know they've been very busy. These are washable, reusable cotton cloth coverings. So if you need any, please feel free to order some from them. There is a self-checker on the CDC website, so it's just it doesn't help you make decisions about medical care, but it does help you kind of guide you about seeking medical care. So it's not going to give you any medical diagnosis, but it'll help kind of guide you through that. So you can go to a self-checker, or if you want to check yourself or someone else, Apple and CDC have come up with a tool called the COVID-19 screening tool, and you can go to apple.com/COVID-19 to download that tool. Here in the U.S., we're at 720,000 cases, 37,000 total deaths. As you can see from the heat map there, North Carolina is not one of the most impacted states. It looks like we're kind of somewhere in the middle, but obviously every jurisdiction that we have here in the U.S., including all of our islands and Guam, have some sort of impact going on. And these numbers are from over the weekend, so they've even changed since publishing them. FEMA rumor control, there's a lot of rumors out there. There's no new rumor to share with you today because I checked that site, but please go to FEMA rumor control, just the FEMA website, you'll be able to find it. Basically, don't be scammed. Do not fall for anyone collecting private information to get any kind of money or anything like that. So please do not be scammed, and it's a great site to go to. One very popular program under the U.S. Small Business Administration, really two programs, the Paycheck Protection Program and the Economic Injury Disaster Loan Fund, that's the EIDL program. Both of them have had a lapse in appropriations. Basically, if you don't have a reservation for your application by now, then you will not have funding for this round. There are discussions going on, I know, in Congress about more funding. The numbers that I'm hearing and seeing would be perhaps anywhere between $250 to $310 billion of additional dollars for the Paycheck Protection Program, and perhaps another $60 billion for the Economic Injury Disaster Loan Program. So hopefully something will be coming soon. So if you're a business owner, don't get frustrated. Just stay in line, stay patient. I am hopeful that another round of money will be coming to help those folks who need it. So just wanted to update you with what we're hearing. In the state of North Carolina, we're still under emergency. Here's the 1-800 number on your screen, and you can also use 211 on your phones for COVID-19 assistance. These numbers came in this morning at 10:30. We are at 6,764 confirmed cases in North Carolina, 179 deaths, and 373 current hospitalizations. What's interesting to me is the number of hospitalizations is actually down from Friday. So Friday, we had about 429 hospitalizations, and now we're down to 373. Now, those are still relatively close numbers on a big old population set, but again, it's just another data point and just kind of worth pointing out. So let's keep being smart and doing what we're doing, and hopefully we'll continue to see these hospitalizations come down, although the death rate is still slightly up. We're still holding at 93 counties impacted. That's been the number since last Wednesday. We do these calls every other day, and so it was 93 counties on Wednesday, 93 counties on Friday, and it's still 93 counties today. So again, just those could be glimmers of hope. I don't know. Just be smart, and I just want to share that with you. The governor, of course, still has a stay-at-home order for the entire state through the end of April. And so that's in place. And if you need any food for children, you can text Food NC to 877-877. Moving on to some volunteers. If you are in the medical community or have a background in the medical community, please go to this website. You can volunteer. North Carolina does need healthcare volunteers. And if you need state unemployment benefits, I'm telling you, I'm hearing they're overwhelmed, just to say it politely. So be patient, but there is the website here for unemployment. There is sort of this movement we're seeing, reopen North Carolina. I'm seeing reopen different counties, though. I mean, obviously, these discussions are starting to happen. There's no doubt about it. And so we'd love to hear your thoughts on it. lkntogether@gmail.com. It's a great email to use. But, we don't want to, ignore the fact that people are starting to say, hey, I want to open my business. It might be a matter of survival in some cases. So just wanted to share that that's going on. In Mecklenburg County, of course, we'll hear some more from Commissioner Pat Kaufman in a few minutes. We're at 1,183 positive cases and 29 deaths. The county extended their stay-at-home order to match the state. So that'll now run through the end of April. And in the past, Atrium and Novant had asked for a field hospital, but they have sent a letter to the county advising that they now do not need a field hospital for the COVID patients for the capacity that they have. So that's an interesting change. I reported that on Friday, but I want to share that with you again. And all Mecklenburg County parks are closed to vehicular traffic, but they are open to walk-in and bicycle traffic. I still see a lot of people parking on side roads and things, entering the parks. So just be careful along those side roads. Don't block any residential driveways, things like that. And there are two loans, COVID-19 Small Business Emergency Stabilization Loan Fund and a Micro Business Stabilization Fund offered through the county. First come, first serve. So don't know where those are in terms of funding. Perhaps Pat will know, but those are programs available through the county as well. And this is an updated heat map, April 16th, still a few days old, but it looks like we're now somewhere between 36 to 49 cases in Huntersville, somewhere between 20 to 35 cases in Cornelius, and somewhere between 5 and 20 cases in Davidson. And if you normalize that based on population, they're all pretty similar percentage-wise, but just is just a new heat map to share with you since April 16th. So let's see. I don't know if we have Congressman Greg Murphy with us today. Greg, are you on by chance?
I am, John. I am.
Oh, wonderful. Awesome. Well, hey, we'd love to hear from you. I talked a little bit about some of the stabilization money, the PPP program money that might be coming. So we'd love to hear what you're hearing, sir.
Yeah, yes, sir. Last night, had a long conference call with Secretary Mnuchin and Mark Meadows, the Chief of Staff for President Trump. As far as initiatives go at this point in time, I believe a resolution has now been come to by the parties. So in all, there will be, as everybody knows, the PPP money ran out. We didn't expect, to be honest with you, the massive response, which is great. People are taking advantage of it. People are getting loans. Been a lot of frustration though for people that signed up and were not able to get loans. So I'm happy to say there'll be another $250 billion out for the PPP loans. That's fantastic. That will help a lot of small businesses that really need it. There'll be another $60 billion for the EIDLs, the economic injury disaster loans that will be able to be applied for. Now the PPP, remember, if you use 75% of that for your payroll, and that's what you're supposed to do, it's a payroll protection program, then that loan will be forgiven. 25% can be used for interest, utilities, other things, but 75% has to go for payroll. The EIDLs, the disaster loans, those are low interest loans that are not forgivable. Those are ones that just are being paid back, but that's being put off for quite a while. There'll be another $75 billion that will go to hospitals, primarily $60 billion of which will go to rural hospitals. Everybody knows that they've shut down. And people are not doing elective cases, and that's really where they get their kind of bread and butter. That's how they're able to stay alive, stay afloat, and so that's going to be a welcomed initiative for our rural hospitals. There'll be another $25 billion that'll go for testing, which is so important as we ramp up and we're able to do what they call point of care testing and surveillance testing. So I'm going to be going back to Washington, D.C. tomorrow, it looks like. Things are kind of still in flux, hopefully to vote on this package Wednesday and get relief to people, hopefully by the end of the week. So I think we're really seeing some light at the end of this tunnel, John, And I appreciate you doing this, keeping folks educated, as again, that's the best way to move forward. So thank you for what you're doing. God bless, and everyone stay safe.
Thank you, Congressman Murphy. And as just a reminder, Congressman Murphy is a graduate of Davidson College, and he also is a practicing physician in Congress, and he's been a regular part of our call. So thank you for what you do for our country and our state. We appreciate you. Moving on to Dr. Jack Faircloth. Dr. Jack Faircloth is a medical doctor on the ground, practices here in our area. Dr. Jack, the mic is yours, sir.
Okay, thanks, John. I appreciate your getting this together. It's really informative for me as well. Today, I just want to update us on where we are in Mecklenburg as far as our hospital capacity, where are we with testing, how are we doing as far as our antibody surveillance to predict what the actual rate of coronavirus may be, what the case fatality rate actually may be. These are not things that our media has done a scientifically sound job of yet due to our lack of testing. So here goes. The first comment is that as far as Mecklenburg goes, we've had 1,183 confirmed cases by limited testing really reserved for sicker people. We have 29 deaths in Mecklenburg, and that gives a case fatality rate of 2.5%. I'm going to show in a little bit, based on the Stanford study, how that's nowhere near accurate, and the fatality rate of coronavirus looks like it's going to be somewhere around influenza. The main issue with fighting coronavirus right now and with fighting the economic fallout of shutting down businesses is that widespread testing is way behind. We have two types of tests. We have a diagnostic test, and then we have a rapidly emerging antibody test. The antibody test is better. It shows a recent exposure of coronavirus for at least a week, and then longer, you'd have a positive antibody test. So that tells us a more accurate picture of where coronavirus has been in our community. As of today, Nirvana and Atrium do not have antibody tests. In the country, 120 separate antibody testing developers have submitted applications to the FDA. Dozens of these are on the market, but only 4 have been approved by the FDA. And of those 4, accuracy is not a gold standard yet. They do not have very accurate tests. The beauty of an antibody test is for the following. Stanford took 3,300 patients, tested their blood with an antibody test, and found that 4% of healthy patients in Santa Clara, California, 4% of these 3,300 had antibodies to coronavirus. Well, if you look at the population of Santa Clara, there's 2 million people there. You take a 4% group of that 2 million, you come up with an actual coronavirus case of about 50 to 80,000. So their recorded case using the Johns Hopkins data or CDC data is a small number of 1,000 because that's based on just acutely or actively sick patients. So we may have coronavirus in our community at 50 to 80 times the rate that's being reported. So why is that important? It's important because the case fatality rate would then be a lot lower, and this wouldn't be such a scary disease for everyone. For the minority, for sure, but not for everyone. So we really need more accurate antibody testing. We need a lot more volume of both diagnostic and antibody testing. And then I just want to put a plug in for opening up the economy solely. The Swedish data is fascinating. They did not force bars, restaurants, gyms, or even schools to be closed. They, in fact, trusted their population to do social distancing, which definitely works. And they're starting to see a decline already, and they don't have massive numbers. So it looks like that maybe we can trust society with social distancing, and maybe we're at the point where we can start to begin to have concentrated plans to open back up. So my summary is that we're way behind in ability to test, behind in quality of testing. I'd say we're kind of almost in the second inning of a 9-inning game there, to borrow a phrase. The other thing is we need to continue social distancing. We're right on with that recommendation. we're probably slightly ahead in our stay-at-home and business shutdowns. And thankfully, we're ahead in hospital capacity for our region. That's pretty much it. Thanks for your time and appreciate the opportunity.
Thank you very, very much, Dr. Jack, and thanks to all your colleagues for keeping us safe. So now we are moving to Mecklenburg County Commissioner Pat Cotham, who it's also noteworthy that Pat is an appointed member of the county's emergency management team. Commissioner Cotham, we'd love to hear some updates from you, please.
Well, thank you. John, what did you say? The last thing you said about it?
Yeah, I have the email you sent me where you said you're on the member of the county's emergency management policy team.
Oh, no, I'm sorry if I came across like that. I was trying to tell you who the members were, but certainly the county commissioners are involved.
Oh, okay. Well, my misunderstanding. So Pat is not a member of the county. Yeah, my apologies. I thought you were saying you were.
Yeah, if I were a member, I would be probably have a megaphone someplace, but nevertheless, I am not. But I wanted you to have a list of the people who were on it.
Okay, well, thank you. Sorry for the confusion.
Oh, that's okay. That's okay. Right now, as of today, we have 1,210 cases. We had 5 people passed away on Sunday. So our death toll, I believe, is 29. One thing that was good about last week, the typical numbers, additions of the virus that were confirmed, it was 32. The previous week it was 41. So I thought that's, we gotta talk about good things too. So that was, an improvement. Over the weekend I had, I spent like all day Saturday and into the evening on the phone talking to people who had emailed me, and they had emailed me wanting to reopen. And some of them were in their emails were very demanding. Others were just, asking, and all of them were concerned. So when I called them, they seemed appreciative that I did call them, and I talked to some people an hour on the phone, just because I believe people want to be heard, and many of them made very great points, and I, told them it was helpful and I needed to hear them, and I plan every day to call people. I typically do call a lot of people who email, just to hear their voices and get their ideas. The people who called me, most of them, I asked all of them, if they could tell me a little bit about themselves, and so that I could kind of get a feeling for who they were. And I had some IT people call me. I had a finance person call me. I had someone who was in operations at a manufacturing company. So it was a good variety. I had a woman attorney I talked to. It was a good group of, variety of people. Several of them said, and the youngest was 29. Typically when people email me, I hear more from older people, but I did have one guy who was 29 who contacted me. But the majority of the people who contacted me, I didn't ask their age, but many of them told me their age. Most of them were, I had one that was in late 30s. The rest of them were over 50 typically. I asked, they were all wanting to be part of the solution, and I appreciated that. And I asked many of them if I could reach back out to them to kind of brainstorm as we get, hopefully if we find out more about, starting to come some kind of a slow open. I do want to be clear that we have not heard any of that, but I'm going to be optimistic that we will start to hear some of that. We have a board meeting on Wednesday. Typically it's on Tuesday night, and I'm not sure why it's on Wednesday, but it is on Wednesday this week. And hopefully we will get some updates on, what that would look like. We have not heard anything about CMS. I kind of think that they won't open again, but I don't know that. I'm just speculating. But I hopefully we'll get, we'll hear a little bit about that. We did hear that the small business, the one that we had, the fund that we had that had $5 million in it, that I did not support because I thought it wasn't enough, and I didn't like it that they were going to spend $1 million to administer it, which seemed ridiculous to me. But nevertheless, they did. I think the money is gone. They had 200 businesses they were able to help, and that's great. But we have about 30,000 small businesses, so I'm glad for the 200. But I still was not. I still thought we should have had a different kind of a infrastructure on that loan program, and I just couldn't. Plus, the $1 million was too much for me. I couldn't stand with that. So, but anyway, that was the update on that. I haven't heard anything about the other fund, which I believe, John, you last week said it had $1 million in it. I thought it was 500,000. I thought because originally it started as 350, and I thought, but I haven't gotten an update on that. The county, I mean, when I say the county, I mean the county manager has been responsive when commissioners email her, and I have had a few, small businesses that were still looking to be open, and I appreciate that. I think it was something people on this call that referred people to me, and I did spend time with them, and one of them I've got one hurdle over, and I'm hoping that I told her, I said, let's just, keep saying your prayers that we'll get through the next one. But I have followed up with the attorney at the county and with the county manager. So they are being responsive, and I do appreciate that. We still have not, I do hope at our meeting that we're going to get an update on this whole, the process, and also what an open up would look like because I know that the previous callers talked about, that there are discussions happening. I hope there are discussions happening. They haven't been happening with county commissioners, but I do hope that, and that's certainly a question I'm going to ask is about that. And if anybody has any specific question they want me to try to ask, I hope that they'll, email me and send that or give me a call, and I'll be glad to talk to you. But that's all I know for today, and I appreciate being on the call. I really appreciate listening to others and giving their updates. I think this is very valuable, and a special thank you to Congressman Murphy and Dr. I can't remember his last name. Is it Lockwood?
Faircloth.
I'm sorry, but
Faircloth.
What was it?
Yeah. Dr. Faircloth.
Okay, Dr. Faircloth. I knew it was 2 syllables, but anyway, Dr. Faircloth. But that's really valuable. But thank you very much, and hopefully I'll have some good news when we chat next time.
Yeah, thank you. And I can vouch, if you have, anyone that sends an email to lkntogether@gmail.com, if it's for Pat, I'll forward it to her. She jumped in for someone up here in our area regarding essential business, and I called that person, and they said they talked with Pat. So Pat, your work is being noticed. So thank you. So moving.
Thank you.
Yeah, thank you. Moving to Cornelius, the town of Cornelius, we have Mayor Woody Washam on. Mayor, I'd love to hear an update from you, sir.
Okay, thank you, John. Interesting follow-up with Pat's comments in that a lot of dialogue coming in my direction regarding the reopening. Obviously, everyone wants it to happen sooner than later. As I walk around the neighborhoods and run into folks, a lot of dialogue and feedback. I'm getting a lot of emails, a lot of texts, a lot of messages on Facebook. I think there's at least an individual or two that are contemplating forming a little demonstration on our famous bridge in the next day or two. So we'll see if that comes to pass or not. I don't personally think that's necessary, but anyway, certainly have a right to do that if they do it within the parameters of the distancing and social distancing and so forth. So we'll see how that pans out. As far as Cornelius is concerned, of course, as we all know, the stay-at-home order in Mecklenburg County has aligned with the governor's, which expires on the 29th of April. So we'll see how that's traveling in the next week, probably, or less. In terms of what happens with that, is it realigned somewhat? Is it extended? I'm just not sure of the answer. I do know that South Carolina is sort of opening up their beaches and some other amenities, some other retail types around their state. That will have, I think, an interesting impact on North Carolina as we move in that direction. As far as compliance, it's still very important for our folks to continue to comply with the order. Our most concern is in our parks, and we have had some issues, as I think I indicated in maybe another call, with disc golf at one of our parks, and had some high school football players trying to coordinate private practices at one of our football fields, and those kind of things just cannot happen. So we communicate with them appropriately and try to get voluntary compliance, which usually takes place. But if they don't, then we have no option but to issue the citations at that particular point. Hadn't had much of that happen yet, but hopefully folks will comply and it won't have to. But things are continuing to go okay with, I think a lot of folks getting cabin fever, including myself. I'm looking forward to the day we can ease back into some normality and move our economy forward again. So that's all I have, John.
Okay, thank you so much, Mayor. Much appreciated. Moving to the Town of Huntersville, Mayor John Aneralla. The microphone's yours, sir.
Oh, hey, John, and thanks for having me. Just a few things. I think the social distancing, Huntersville residents are doing a great job. You mentioned the numbers that we have that have contracted the virus. Pretty small when you consider we're 65,000 people, so keep up the good work with that. Supporting the local restaurants. I've been out and about, driving around, even ordered some food here and there, and there are actually lines. People are sitting in their cars waiting to do pickup, so that's encouraging. And then, like two of the previous callers, small businesses are certainly getting itchy to open. I will point out that the website healthdata.org is something that a lot of people are looking at, and they think, according to the numbers, early May, mid-May would be okay for North Carolina as a state to open up. And I think the real issue right now is there are businesses that have been opening up that were closed initially because the North Carolina Department of Revenue has the ability to grant a waiver. And there was a recent article in the Charlotte Observer, 4,000 companies have applied for that waiver, and 85% of them have received it. So you may be a business that competes with a business that had applied and was granted this waiver, and you're closed and they're open. And that's really, I think, bothered a lot of people throughout the state. So that website is www.ncdor.gov. If you would like to apply for the waiver, seems like you have a pretty good chance. 13% of the businesses that were deemed non-essential were still allowed to be opened. So I think we need to really consider right now some consistency and fairness throughout the state. And basically, if you can buy a product at a Walmart or Target and your store has been closed because it was deemed non-essential, I believe under the current guidelines, starting April 30th or what have you, you should be able to open and compete. So that's my 2 cents on that issue. Right now, in terms of our town board meeting, we have a 5 o'clock budget discussion tonight, virtually, and a 6 p.m. meeting, virtually, obviously. And then at 3 o'clock today, I'm having a town hall meeting with Senator Tillis, North Carolina State Senator Marcus, town manager Anthony Roberts and Hannah Sayborn from Mecklenburg County. You can go on our Facebook page and listen in and watch. So that's all I have, John, and we'll keep moving things forward here.
Thank you, and good luck with your teletown hall this afternoon. Moving to the Town of Davidson, Town Commissioner Matthew Ford. Are you with us today, Matthew?
I am. Sorry, I've had a couple of work conflicts the last couple of meetings, so my apologies for not attending. The only real update I have is that at our last board meeting, we approved $30,000 to move out of the general fund to be set aside for PP&E for our staff, for police and fire and anybody else that would be considered essential that's out there. We wanted to make sure that our staff were fully covered and protected, and we didn't want to have the town manager or the finance director have to come back and ask for additional funds on an as-needed basis. So we've set aside $30,000 for some additional PPE to make sure that we're protecting our staff. Other than that, I think everybody else before me has covered everything else, so I don't really have anything else to add.
Yeah, just real quick, Commissioner Ford, all the parks, I know Huntersville, Cornelius, Town Park's still open. Vehicular traffic, same thing with Davidson, correct?
I think for Davidson, we're actually we're not allowing parking. So if you can walk to the parks, you can get there, but if you park, your car will be towed. So we.
Oh, wow. Okay. Okay. Yeah, that's a big update. So you heard it here, folks. Don't park at the Davidson parks, walk or bike. Is that right?
That's correct. If you can walk or bike, you can access them, but Fisher Farm and some of the other facilities you cannot drive to and park.
Okay, very good. Okay, that's a good update. All right, very good. Well, hey, thanks so much for joining. There's no updates from Rhonda Cheek, who's the CMS board member. They just came off their, quote, spring break, and I kind of did, you can't see me, I did a little air bunny spring break because, you know, I guess families did the best they could, but there's no updates to offer here. But I do know if you need some food for lunches, they still have their hotline open, and you can email this particular address. And then moving over to the Lake Norman Chamber of Commerce, we have Chief Executive Officer Bill Russell, who's been on every one of our calls. Mr. Russell, the microphone's yours, sir.
Thank you, John. First off, the Lake Norman Chamber has created a business resource guide on our website at lakenormanchamber.org. This resource guide has links to healthcare and business assistance resources, and it's essentially a one-stop shop for our business needs. We also had an outstanding Focus Friday this past Friday with Mecklenburg County Commissioner Vice Chair Elaine Powell, who discussed that county assistance that Pat was alluding to, and as well as Eileen Joyce with the Small Business Administration. That program was recorded and again placed on our website at lakenormanchamber.org. This coming Friday, the Chamber will co-host U.S. Senator Tom Tillis with WSIC-FM and a special edition of Local Biz Now. That program takes place at 8 a.m. on 105.9 FM, which has coverage from Huntersville to Statesville, so it's a wide coverage area. It will also be on Facebook Live, so you can watch it live. The Chamber's had a number of programs that we put together virtually, including the John Maxwell Leading Through Crisis, which has one more session, which takes place tomorrow at noon. You can go to our website and RSVP your attendance and be part of that Zoomed. As Mayor Washam alluded to, we continue to hear from business owners and managers who are very anxious to reopen their business. Today, John, you know, our native home state of South Carolina, Governor McMaster is going to, the beaches have already been opened up, probably going to relax some things in terms of retail businesses. As it was alluded to by Mayor Washam, I think that's going to have a big impact on the state of North Carolina as we move forward. Again, people are very, very anxious to get back to business. Just let Mayor Washam know I'm not going to be one of those that is protesting on the bridge, though. I'm not going to be doing that. But again, we thank everybody for supporting the restaurants and going out there. And as Mayor Aneralla talked about, I too have seen a number of people supporting our restaurants, pulling up, sitting in drive-throughs. Thank you for doing that. That is having an impact on our local business. So thank you for supporting those local restaurants. And hopefully we can get some of the retailers back in business very, very soon. And there is a light at the end of this tunnel, and I think we're gonna get there very soon. So again, thank everybody for their support of our local business community, and thank you, John, for putting this on.
Yeah, you bet. Thank you so much, Bill, for your leadership. On your screen, you see the Huntersville Chamber. We have an open invite to them, so just wanted to share their website, just so you have it. Just as a reminder, visit Lake Norman. They are supporting our hospitality workers in a virtual way. They have a virtual tip jar they've set up on the Visit Lake Norman website. So you see the website right here on the screen. And every time you visit the website, a new person is featured for virtual tips. So what a great, great way to support waiters and waitresses and the hospitality staff that's out there. And so real kudos to Visit Lake Norman for their leadership and setting that up. Again, thank all our panelists. I'm your moderator, John Bradford. I enjoy doing these calls, and we've had just a phenomenal group. On Wednesday, we'll have Thomas Stith again. He's the director of the state director for North Carolina for the United States Small Business Administration. With hopefully what's coming out of Congress, he'll have some updates for us there. And then I think we're also going to be joined Wednesday by the North Carolina Speaker of the House to talk about some of the things they're working about, hopefully moving towards reopening. And our next briefing will be Wednesday, April 22nd. If you have any questions or comments, keep the emails coming. I've received several, and I know we've helped several people, so I really enjoy that. lkntogether@gmail.com. We are stronger together. Take care of yourself. Take care of each other. This does conclude our briefing call today. Thanks for listening.